everyone, and welcome. My name is Lisa Parshall. I am a fellow here at the Rockefeller Institute of Government. I want to thank you all for joining us today for today's annual Local Government Lab, whether you are in person or live on our live stream. Before we begin, I'd like to make just a few housekeeping notes. This forum, as noted, is being live streamed and will be available on the Institute's YouTube channel and the Institute's website for those who are unable to attend in person. Secondly, considering everyone's experience, we ask that you silence all cell phones for the duration of the event. For your convenience, there are restrooms located on the first floor. For those needing accommodation, accessible bathrooms are located on the third floor. We'd also like you to take note of the fire exits, and in case of an emergency, be sure to make a calm and orderly exit. If you need anything, Bridget Ebenbach, our conference manager, is in the back, or just let any one of our staff know and they'll be happy to help you. Finally, just note that we have designated a time for a moderated discussion between the panelists and the audience. So please hold all questions until each panelist has presented, and we'll have ample time for Q&A. So thank you. And I would like to now welcome Bob Magna, President of the Rockefeller Institute of Government.
There really is no reason to applaud. I want to welcome everyone today. I want to get right to the business of why you're here. We try to do this every year to give a forum for folks who have an interest in what's going on with local government issues. I think we're going to work on the timing for next year. I think at this time in the summer is not always great to get people, especially when the legislative session goes until the last possible minute and the budget the minute before that. So in any case, thank you all for coming out. Again, listen to the Lisa prohibitions today, and let's just get started. Thank you all for coming. Again, no applause. Let's get going.
All right, I would like to invite our first panelists to come forward, please, and take your seats. Thank you, Bob, and thank you to our audience and panelists. As mentioned, I'll be the moderator for our first panel, Infrastructure and Environmental Health. And at this point, we'd like to turn it over to our panelists. We have two presentations today, exploring the ways that localities are approaching different environmental health infrastructure issues, the challenges and opportunities present with respect to those issues across the state, and the lessons that we can take from our collective experiences moving forward. So again, as a reminder, please hold all questions to the end. So I'm happy to introduce our first presentation, our very own Matilda Scott, from a policy analyst here at the Rockefeller Institute of Government, and she's going to be presenting on power permits and pushback, debates surrounding data centers in New York State.
Perfect. Lisa, do you have the clicker? Excellent. Okay, so good morning, everyone. My name is Matilda Scott. I'm a policy analyst here at the Rockefeller Institute of Government. I'm also a PhD candidate in environmental sociology at the University of Utah. So my training is in environmental sociology. But today I'm going to be presenting our ongoing research about data centers. So we recently published a policy brief and a follow-up blog tracking some of the issues surrounding data centers, both nationally and in New York. And we're going to be publishing more projects on this. So this presentation is going to be an overview of data centers and the issues they present in communities, issues and opportunities, and then examining the state and local responses that are currently occurring across New York. So to get started, we hear a lot about the cloud, right? But the cloud really isn't just something floating in space. It's really deeply physical. So data centers are the backbone of this, and they power kind of everything that we do online. So whether it's checking your email or the conversation right now is really focused on generative AI and the enormous power and computing demands that they take to run. So every single time you send an email, stream a video, or use an AI tool, you are connected directly to one of these facilities. And these facilities within them, they have server racks, fiber optic cables, heavy-duty cooling systems, and a lot of physical infrastructure components. So in this conversation, there's oftentimes competing demands about the economic promises that data centers present and the significant environmental and utility challenges. So that was really the topic and theme of the policy brief that we recently published called Clouds, Cables, and Megawatts, How States and Localities Grapple with the Data Center Boom. It really explored these issues much more in depth than I'm going to today. So, and it explored relevant federal, state, and local responses. But again, these things are changing very quickly right now. So even though we published it in May, there have been some advancements that I'm going to speak on today. So, again, this slide really explains a little bit more in depth about the types of data centers and the physical parts that are within a data center. So oftentimes we hear about server racks and CPUs, GPUs, graphic processing units, and computing processing units. GPUs are oftentimes in conversation with the generative AI boom that we talk about a lot today. So where are data centers? So within the United States, which is really the worldwide leader of data centers, they're really concentrated currently in Virginia, and particularly in Northern Virginia. So about 70% of all online global traffic goes through a data center in Northern Virginia, which is kind of wild to think about. But along with that, other states have really been emerging. So Texas, California, Illinois, Georgia, and Ohio are emerging markets. And even within New York, we see a growing interest in data center development. And within New York State, the biggest markets currently are New York City, Buffalo, and Albany. And oftentimes, getting exact counts on where data centers are, it's a little bit tricky to do because there's not a lot of this data of currently existing data centers is private, so counts vary depending on which source you use. But there's about 134 currently operating data centers within the state. So economic trade-offs, very briefly. To understand why local communities are starting to push back, we have to really understand the economic realities of these projects. So tech developers oftentimes pitch data centers to local industrial development agencies and other communities and local governments as a major job creator. But when you take a closer look, there's really a disparity between the amount of temporary construction jobs and then permanent operational roles. So researchers have shown that there's about a 1 to 12 on the low side, or a 1 to 30 ratio, meaning that for every single permanent job created by a data center long-term, it supports about 12 to 30 short-term construction roles. So it's not really supporting permanent jobs. It's really a fraction of the job creation that's supported. So once the building is up, it operates largely as a warehouse that's empty of human workers. It may only employ a few individuals full-time. So, and to make some matters more controversial, at least 36 states, offer tax incentives to help incentivize companies. And a lot of states are not required to disclose exactly which companies are receiving these tax breaks. So that's been kind of driving some of this pushback. So along with that, there are also concerns about energy, water, air pollution, utility rate increases, and noise pollution. So a single hyperscale data center, which are the largest type, they can consume as much as 81,000 average American homes. So it's an immense amount of power that's consumed. And there's also concerns about water. So a single hyperscale facility can consume up to 5 million gallons of water every single day, and this water is used to keep from servers from overheating. So additionally, for people living next door, the impacts are really kind of additional, right? So we have noise pollution. People who live near data centers have described it as a constant buzzing sound that really decreases your quality of life when you're exposed to constant sound. And then people in communities where there have been increases in data centers have seen residential utility rate spike increases. So more studies have gone in depth in this, but Virginia, Illinois, and Georgia, regular residents have seen electricity rates increase from 12 to 15% because of this increased grid demand from data centers. Additionally, air pollution from massive diesel backup generators really creates health issues for communities that house these facilities. So, very briefly, there have been proposed data center legislation at the federal level, which the policy brief really details more in depth, but there's been a shift in promoting AI development, promoting data center development more recently, and then also a pushback on data center development. So, there have been proposed federal moratoriums, which is a temporary pause on data center development at the federal level. And these things are kind of currently playing out. But for today, I really want to focus on state level responses and local responses. So within New York, well, at least nationwide actually, 22 states have introduced legislation last year. And this year, the number is increased dramatically as this issue has gained national prominence. So, and the legislation has kind of been brought up in buckets, right? So we have legislation introduced for ratepayer protection, renewable energy, siting restrictions, tax incentives, grid reliability, and then moratoriums. Again, that pause in development. So more specifically, within New York, there's been really exciting and developing news. So the New York legislature recently passed a comprehensive one-year moratorium on new data center approvals. This was through Assembly Bill 11560 and Senate Bill 10642. And this legislation is currently waiting a final response from the governor. So this, again, is very fast-moving policy landscape as people really, this issue, I think, really captivates communities all across the country and the state. So the goal of this moratorium is to freeze new development while the state can fully study the cumulative impacts of New York's green energy goals and grid stability. So along with this moratorium, there are a few other really exciting proposals. The Stop Subsidizing Data Centers Act, which aims to eliminate tax incentives for data centers. Additionally, Assembly Bill 10216, which seeks, again, to repeal some existing tax incentives, specifically the sales and use tax exemption that is enjoyed by data center developers. And then the New York State Sustainable Data Centers Act, which would mandate strict environmental, water use, and energy efficiency standards for any facilities that operate within the state. So, and this map is, again, from our policy brief and shows currently operating data centers within New York. And then more specifically, to talk about local government actions. So when we look at this policy response at a municipal level, we see that local towns and counties really are using their power over zoning and land use and are starting to restrict these developments, both in response to proposed developments and kind of proactively, sometimes even before a proposed project. So more specifically, North Tonawanda, which is in Western New York, local officials have enacted and recently approved a 1-year extension on their local data center moratorium. So again, this extends an already existing freeze on new projects while local leaders are able to more figure out how to protect their community's power grid and the local environment. Then we see a variety of other smaller towns, Dryden, Lysander, and Perth, which have passed their own localized bans and moratoriums, refusing to allow these data centers to move in without fully really understanding the impact that they'll have on these communities. Then we have St. Lawrence County. There are quite a few proposed data centers, including a hyperscale data center that's been proposed in that area up north by Canada. And so they're really, at the county level, they're recognizing this as a regional threat. And the county board took a unique approach. So they passed an official resolution that's actively encouraging all local municipalities to adopt their own moratoriums. So they're encouraging their towns to act at that level where they have the legal authority to do so and to help protect the resources of the county. So in the town of Allegheny, rather than a flat ban, they took an approach by aggressively updating their local zoning codes, and they established strict siting mandates, noise ordinance, to ensure that if a data center wants to be built there, it has to play by their own standards. So they're kind of proactively creating these zoning restrictions. So again, these municipal actions do not happen in a vacuum, but they're driven by grassroots activism, community activism, and we see this even occurring here in Albany. So this picture is of Albany residents protesting a data center proposal. Just earlier this month, there's a proposed data center in Albany, and we really see pushback that's happening from grassroots activism. That's really driving these local responses. So again, this is ongoing research that we're doing here at the Rockefeller Institute. We hope to launch a dashboard in the near future that tracks the operating data centers, the proposed data centers across the state, and then that can really completely track all these local level responses and provide this tool for researchers. So we'll continue to monitor these policy responses as they continue to develop.
Thank you.
Thank you.
For our second presentation, we have Emily Pramick. She's the lead budget and policy analyst at the New York City Independent Budget Office. And she is going to be talking to us today. Our presentation is Lessons for the Future of New York City's Bike Share.
Can you all hear me okay? Great. Good morning, everyone. So I am actually now a senior budget and policy analyst at the New York City Independent Budget Office, where I cover transportation and transit policy. The Independent Budget Office, or IBO, is a city agency whose role is to provide nonpartisan, reliable information about New York City's budget, its policies, and we do that for all New Yorkers, whether elected officials, advocates, or the general public. We provide our own independent budget and economic forecasts for the city, but we also do our own policy research, which I will share an example of with you all today. I want to mention before I get into the presentation that we do take research requests. So if you have a question about New York City policy, if you have a question about the budget, please reach out directly. I would love to hear from you. All right, so last November, let me see here if we can. Can you show me how to do it? Yeah, just. There it goes. Okay, perfect. So last November, IBO released a pretty big report on City Bike, New York City's bike share system. If you have visited New York City in the past decade, 12 years, you have probably encountered a city bike. Maybe you've even ridden one. There were over 50 million trips on City Bike last year. The service is absolutely growing. It's very popular. 135,000 members, annual members as of this spring. And it's this spring, actually, once the latest expansion finishes, 64% of New York City residents will live within a 5-minute walk of a City Bike station. So this is increasingly part of the city's transportation network. It's part of our infrastructure. And all of that has been achieved for the low price of $0 in public funding. So we think this is a very interesting example of major infrastructure at very low risk to the city's budget. That does come with trade-offs, though, which we will talk about. Before we get into the findings, though, I want to give you an overview of how the program works. Let's see. Is it? Oh. Sorry, folks. I think you had the magic touch. Let's see if we can. Okay. Promise you guys these are great slides. You don't want to miss them. Okay, no problem. Yeah, I think maybe.
I think I was pointing.
Hey, there we go. Perfect. Thank you so much. All right, so City Bike is a public-private partnership. It is actually run with relatively little day-to-day involvement of the city. As a service, Lyft is the private owner and operator of City Bike. They provide everything from the bikes to the docks to the app that you check the bikes out on, maintenance. And the city, in turn, grants the use of the public right-of-way to place stations and run the program. So you can see, for example, in the picture on the slide, stations are often in the street, they're on the sidewalk. The city grants Lyft the right to place stations there, and that right is exclusive. So Lyft is the only one allowed to run bike share in the city. There has actually been some legal challenges where the city has kind of defended that right. So this is something that is publicly protected for the operator. And all of that is governed under including prices, including service levels, governed under an operating agreement contract between City DOT and Lyft. Lyft, for its part, retains virtually all of the revenues from the service. There is a small revenue share back to the city, but in large part, they are doing this because they retain the revenue from riders and sponsorship. That operating agreement that runs the program expires pretty soon in 2029. So this is a long-term contract that has been extended through its options. Now is the moment for the city to start thinking about the next iteration of bike share. All right. So what did we find in our piece? Well, first, we found that City Bike is popular, but the price for riders is increasing. So you pay for City Bike in two different ways. You can buy an annual membership where you sort of prepay for a certain amount of included trips. You can also pay per ride, so you don't have to have a membership. You can just pay, pick up a bike, and go. The prices, though, we did examine them from the start of the program in spring of 2013 all the way through January of 2025. We found membership prices, that cost of that annual fee increased. It's now 80% in real terms since 2013, so that's as of January. We also found that e-bike fees, so the additional charge you pay to take out an electric bike, you pay per minute. For members, that's also increased almost 30% since those bikes were introduced in 2020. So prices are rising drastically. This has not gone unnoticed by policymakers. There's legislation and city council to try and cap the price for members. There's also efforts to expand discounts. IBO as an office doesn't weigh in on whether those are good or bad ideas, but we do point out that in the contract, The price caps, they've held. So prices have remained not only at, but often below the price restrictions that the city has with Lyft. And so if they're, no matter how you feel about the price, if there's an interest in bringing them down, the city will need to look to the structure of the contract to address that. Thank you. All right, so we didn't just look at City Bike in this work, though. We also looked at 7 other major bike share systems, both here in the US and abroad. And we found that City Bike also had the highest prices for its service of all of those systems. The chart that you see here is a price for single rides. So those are, if you're not a member, how much does it cost to pick up a bike and ride? You usually pay an upfront unlock fee and then a per minute charge. So what you're seeing here is a 15-minute trip on both traditional manual bikes on the left and then a 15-minute trip on an electronic bike. Each of the bars is one of the cities that we looked at. The dark bars are City Bike, and as you can see, they're taller than the rest. The prices really are much higher, especially in the cases of e-bikes, for City Bike than these other major bike share systems. Interestingly, City Bike was also more expensive than other systems operated by Lyft. So this is not just something about Lyft systems, it's something going on with New York City specifically. And I think actually I'll leave it there if we can keep going. Oh, I'll mention too, single rides we think are an important metric to study. It's not just about the annual membership. If you want to pick up and try a City Bike, that cost is going to matter to you. And if the city is interested in increasing ridership, getting more people, taking an active form of transportation, they may want to address this. There's no price control in this in the contract. So it's something to think about going forward. Thank you. Oh, you got it. Okay, so City Bike was the most expensive, but every bike share was different. There are a variety of strategies that other cities have used that seem to result in lower prices. Some cities publicly subsidize their programs, so they may provide the difference between the costs of the operation and the revenues. This was the case in DC and Montreal, just a straight operating subsidy. Some cities capped the price of their service. This is the case in LA. If you've ever ridden Metro Bike Share, the cost of the trip is set to the transit price, so same as riding the Metro bus. That's another way of addressing it. London, for its part, has a lot of discount programs. They were actually the second most expensive bike share, but we couldn't even fit all of the ways you can qualify for a discount on this slide. You can be a student, you can be a senior, you can work for the NHS. There's many different ways to get a discount, whereas City Bike just has a couple ways. You either have to be on SNAP, you have to be a public housing resident, or a member of a couple credit unions, and that's really it. So there's sort of more expansive options in some of the European examples. And then last but not least, some places have just negotiated lower prices. This was usually found as part of an expansion deal. So in San Francisco and in Chicago, they recently expanded their programs to new areas, added new stations. The city paid for that capital infrastructure, but then in exchange, Lyft lowered the price of memberships or added discounts. So we do see a little bit of trading public investment for affordability. And if that's something this city is interested in, that may be something to consider in their next procurement. All right. So one thing, though, that we want to mention is if New York City is going to apply public funds for the very first time to this program, you want that to come with transparency. And IBO actually estimated the operating costs of City Bike for 2024 because it's not something that's published by Lyft. It is not required under the contract. It's not something they issue publicly. And we felt very strongly that policymakers and the public should have a point of reference for how much it costs to run this service if there's some consideration of applying public money to it. I don't think we have time to get into the details of the estimate, although I'd be happy to take questions, but we do think this $128 million that we found, which is the estimated hard costs of running a bike share, things like labor, warehouse space, equipment rentals. That gets pretty close. There's probably a few other costs in there that we just couldn't estimate, things like insurance, executive comp. But we think that gets pretty close to the cost of running City Bike. And the biggest bottom line here is just if the city is going into this procurement, you have an opportunity to get that information from the operator, from other people, other operators bidding. This is a moment to get more transparency for folks. Okay. So yeah, the expiration of this contract is in 2029. If you know anything about procurement, that's like tomorrow. It's really coming up. This is the moment of opportunity for the city to take a step back, think about what's next for bike share, and use that process to forward its goals. When City Bike was first set up, there was sort of a risk-averse approach taken. 2013, folks didn't know if people would use bike share. They didn't really know if people would feel good about biking in New York City. I think we've seen just from the explosive growth in ridership and the massive investment in bike lanes in the city that is not the case. Folks are using the service. The city may want to address new goals in the next procurement, whether it's boosting ridership, affordability, environmental goals. All of it can be on the table. But just we encourage folks to use that process to think through the objectives of the next contract. We also emphasize the need to get more information. So this is a moment to ask bidders to provide more transparency into their operations, or maybe require it under the next contract. You really do not want to be paying for things that an operator would do anyway with public funding. You want to make sure you understand where that money is going and why public funds are needed. And last but not least, the city doesn't have to stick with the current model. We looked at 7 other bike shares that had different operators, different business structures. There were nonprofit operators, there were city-owned services. So all of those could be under consideration as the city thinks about its next bike share system. The real bottom line from all of this is to plan now, though, because any change is going to involve transition costs. RFPs can take a long time. So we hope that this research and this overview is helpful to not just city policymakers, but anyone who uses bike share. And yeah, we would love to take questions, and I encourage you to check out the full report.
Thank you. So thank you both for your presentations. We're going to move now into the question and answer period. Just for the interest of those who are online, if you could wait if you have a question until someone from the back gives you the mic. We have somebody coming around with a microphone for the question. So open it up to the audience.
Matilda, just out of curiosity, is there a proposed location in Albany for the data center?
There is a proposed location. It's the Kenwood. It's the location of the previous Stone Dewart School. Kenwood Commons or Kenwood? Okay. Yes, I'm happy to provide after too more information.
Still sticking with the data center question, you had mentioned, I think it was the town of Allegheny that had updated their zoning. I'm just curious, what did they base that on? Are there data out there about what a good zoning update would look like?
That's a great question. I'm not exactly sure the details of what prompted them in that situation, but I know that there are many different zoning approaches that localities are taking both within the state and across the country to kind of update and be more proactive with these zoning things. So I'm happy to look into that instance a little bit more because I don't know off the top of my head.
Yeah,
so
I'd be really interested in having some kind of a tool or reference point for localities to use if they are considering updating their zoning. I think that would be a really valuable service.
I definitely agree. That's an excellent point.
Hi, thank you for this. I wanted you to comment, and maybe this is me just being devil's advocate. New York State has been an incredibly enthusiastic supporter of AI. The university down the road had something like 22 faculty positions in the last few years that have supported AI. And yet we're concerned about data centers, which seems to me to be an incredibly large policy misalignment. And how are local municipalities supposed to react when the state of New York hasn't quite decided whether we're in support or not in support? And are any other states doing this better than us?
Ooh, so much there. so much. I think every state is dealing with the challenges that this presents, right? So along with the moratorium, Maine was actually the first state's legislature to pass a moratorium that was vetoed by the governor. But I think your characterization, that's an interesting perspective, but I think from like the local government perspective, right? If I'm a small town that's really worried about my water and I have a data center coming in that's not going to really employ people, I think there's more difficult trade-offs that we need to consider, not just at a state level, but also a local level.
So how does it not just become more NIMBYism?
Yeah, I mean, that's a great question. We have a lovely undergraduate student, Nikili, here today who's studying AI, and we were having discussions actually about NIMBYism and how does this not just fall into another example. I think it's a little bit particularly hard to comment as a researcher, right, when things are moving so quickly too, right? So we don't have exact data. My position as a researcher, right, is not necessarily to say what should happen and my own personal opinions, but really to respond and look at like what is happening and what are these different approaches people are taking. But I think respecting like what communities have to trade off and the fact that it is a really difficult choice, right, that every community has to make.
I have an interest in the water wastewater side of the data center equation. Have you looked at the impacts on municipalities in this study or otherwise generally, maybe relative to the size of the data center, their structure for the water wastewater treatment, and then contaminants in the wastewater? I don't know.
Yes.
I have no idea, and I'm not finding that. Have you looked at whether there are contaminants or what happens to the wastewater? Because we also have a very strong proactive clean energy and clean air and clean water, concerns. So
Yeah, that's an excellent question. And again, all things are emerging, right? And we don't exactly have complete data. I will say our director of research here, who couldn't be here today, Laura Rabineau, and we do oftentimes work with a lot of water contaminant research, a lot of research on PFAS and forever chemicals. So I think that is a great avenue to pursue. And I know other researchers with different expertise are looking at this issue from many different vantage points. So I think that's another concern to bring up and something we'd love to explore in the future.
yeah, I would love to see that on the radar for sure. And then just a kind of a tangent on that question. Do you know if any of the moratoriums are based on user rates or
Like capacity, like electric capacity?
both
Absolutely.
in water and out water, and the impacts on the ratepayers and that kind of thing?
Yes. So again, one of the, we published a follow-up blog that outlined different kind of state moratorium approaches, and we classified them based on electric capacity. So some are defining, 20 megawatts of power, some are going, up to 100, and some are much smaller. And then there's also a bill that characterized, and we're specifically looking at how the legislation defines data centers, and it's usually by electric capacity. But there's a new bill that also targets the water use as well in New York State.
That's great to hear. I appreciate the energy side of the equation. I'd also kind of like to put that out there to see the water and wastewater.
Yes.
Where it goes, what's in it. So I'll
And I can follow up on the exact bill or provide it to you later, but they're working.
Hiya. I have a question for Emily, actually, about the bike shares. I actually just, right before this, got the code for the free Albany bike share for the Albany social cycle tonight.
All right.
And it's been really interesting thinking about bike shares as one of the solutions to that last mile problem for transit. And I thought that bringing up that the fact that LA caps it at the same transit price is being really interesting. Have you found any bike shares that are, sort of that tied in with transit? Like, are there, would there be an opportunity for MTA or for, someone like a county or regional bus authority to become more involved in the sort of bike share program as a way to sort of magnify local transit?
Great question. That is how we see people using City Bike as well, though, to connect to transit. So I don't want to make it sound like that's not part of what City Bike does. You do absolutely see people using City Bike to get between subway lines, to get from the subway to a bus or a ferry. There have also been one of the proposals in the New York City Council is to cap for members the cost of a ride to the cost of the MTA fare. So there is definitely an active conversation about kind of tying the two price points together, even if the network is already kind of connected in that way. The best example of what you're talking about, though, where there is a very tight connection between bike share and transit, was something we saw most in Montreal's Bixi system. Bixi is a nonprofit-run bike share. City of Montreal subsidizes it. There's also some federal subsidies as well. But the nonprofit's mission is to make a very efficient transportation network with the bike share system. So they've really designed it around those kind of connections, those daily trips. They kind of figure out like where people are commuting and when you might need a bike. And you actually do see it in the data as well. If you look at trips per bike per day, their system is among the highest that we saw. I think only Paris had higher rates of utilization. I'm not sure why they've invested a ton in biking infrastructure in that city, so that may be part of the story. But yeah, you absolutely do see systems that are very much integrated in the local transit system. So something for New York City to think about. We do know that people are using it in that way, but is there a way to design the next contract to support that even more? Yeah.
I just wanted to address the NIMBY thing because I think it's pretty easy to kind of go down that way. One of the problems right now with the way that particularly the larger data centers are being presented to the public is a serious lack of transparency, which doesn't exactly create trust. Now, that's not everyone, but that's an awful lot of them. The other piece of it is that, I mean, from my perspective, I don't think that there's enough attention paid to how, particularly in a grid-constrained environment, which is what we're dealing with in this state, what we can do to ensure to the extent possible that these facilities are self-sustaining, that they have integrated renewable sources as part of them, that they recycle their water to the extent possible, that they really try to do things to mitigate the environmental impact. Some facilities are doing that, but many are not, because there's a cost associated with it.
Matilda, just wondering on the job creation side, because we get into these conversations of, if you looked at all at some of the other potential benefits that the data center companies might be paying into the community in terms of taxes and other host community type stuff, because I think we can get into these discussions about looking at actual job creation versus revenue that comes into the area.
Yeah, absolutely. And again, in the report, it goes a little bit more in depth than I can go into today. But a lot of this research does come from advocacy organizations for data centers and they project quite a large number of employees, both indirect and direct in Northern Virginia. A lot of this research comes out of. But it is true that in some communities there is quite a bit of tax revenue that is coming. And again, these are cited directly in the report, and I'm happy to talk about more. But it's a little bit hard to talk again about something so complex as data centers and such a hot topic in such a constrained time. So I'm happy to go more in depth at any other time.
Okay, well, on that note, we can continue the conversation over the break. So that concludes our and try to reconvene here around 11:35. And in the meantime, again, hoping you all can talk to our panelists after the presentation too. Thank you both so much.
these are 20 to 30-year projects, both on the wind and solar side. Some may be retooled, put new generators in the windmills, update the solar. Others may, we're in a world of rapidly advancing technology. I tend to think that by the time some of these projects run their course in 20 or 30 years, we'll be on to other technologies. So it could be a real threat. And if you want to see a dramatic little video, the old Fenner wind farm in Madison County, they toppled those towers this spring and decommissioned that project, and you can find it on social media. It looks like giant trees being chopped down there. So there is precedent that some companies are making that decision to take these older towers down because they're less efficient. Another avenue besides pilots is a host community benefit agreement, and we really look at this as a way to bring some of this money in a way to support infrastructure without affecting fund balances, without affecting tax calculations for school districts. And we've shifted to our negotiations where we are looking to bring more of this money into the community through host community benefit agreements instead of pilots, because it provides more opportunities to reinvest this money. So we kind of work as a group. The sausage making part is the municipalities, the school. We work as a group when a new project comes to town to get the size of the pie as big as possible, and I won't apologize for that. We're hosting these projects, and we're going to negotiate just like any other negotiation to make the size of that pie as big as possible. But then we work behind the scenes to figure out how we split up that pie between the county, the school, the different groups. And there's other factors in how big that the developer is willing to make that pie based on what some of the other requirements are from the municipalities on zoning and planning and those sort of things. Go ahead. So just a couple examples of the directions we've moved. Copenhagen Wind Farm was built about 5-6 years ago, and the township thought, well, they were doing pretty well. They negotiated a $400,000 host community benefit agreement, paid over 2 payments. And I don't mean to be critical. It was a good group of people working on this, but that money ended up going to the town in the hands of a volunteer board, and there wasn't a lot of strategy on how that money was going to be invested into the community. And so kind of as little projects came along or a cemetery needed some work, they would give out some money. And I don't mean to be critical of that. That's important stuff for communities to do. But we looked at that as like we really need to be more strategic. And I'll go back to my work with dairy farms. Dairy tends to have a milk price cycle that goes up and down. And we always talk to farms about it's so much harder to manage your money when you have it than when you don't. When milk prices are down, you pay the bill that's in front of you, you fix the thing that's broken, and you don't have to spend a lot of time thinking about what you're doing with your money because there's none there. When prices are high, now how do you invest that money to position yourself for the next down cycle? And that really is a critical piece of where we see successful farm businesses versus ones that struggle, is how they invest that money. So we view this the same way. And another wind project we had where we negotiated an annual host community benefit agreement through our development corporation of $150,000 a year with an escalator. And we set up, you can advance, this is the last one, I think. We set up a review panel and some different projects where we could look to be more strategic about investing this money into infrastructure, into community needs that we're going to, with our goal is that this is going to be base infrastructure that is going to improve our industry and improve our tax base in other ways. So if these projects do go away over time, we've used those resources that came into the community to build other tax base to make up for that difference. So I think that's all my time, and I think that's all I had. Yeah, so.
Thank you so much. I'd now like to welcome our second presenter, Jim Thatcher, a manager at the Community Development CT Mail Associates, and his presentation, Getting Dirty, Challenges and Solutions for Financing Municipal Infrastructure. Welcome.
Thank you. And thank you to the Rockefeller Institute for inviting me on Monday of this week. That's awesome, but I'm very happy to do that, to do this and meet all of you. I'm very pleased to be up here with two Cornell people on their names. All I can say is I went to Cornell a long time ago, but I'm not affiliated anymore with the university. But that's cool. I feel a little nervous being with Cornellians. Oh, I didn't know I had animation. Okay, I'm going to get through really quick. We are going to get a little dirty, not too much, don't worry. CTMail, multidisciplinary engineering firm, just up the road, up the Northway. I'm out of the Glens Falls office. I lead a team of 3 people that do public financing and community development. That's all we do, and I have to get along with engineers every day. So. Okay. I'm going to talk a little bit quickly about the state of municipal infrastructure financing, get through some obviously challenges with that municipalities are facing. Thankfully, there are some successes and some solutions I want to highlight quickly. And if I leave enough time, hopefully I can get into some things I think you're probably a little more interested in, which is a practitioner's take, I'm the practitioner, on some policy matters dealing with infrastructure. So, and I'm going to double click here just so I can. The arena I'm in day to day is traditional hard infrastructure, water, sewer, stormwater, sidewalks, parks and rec. But I want you to think about municipalities that have to care about or pay for lots of other things as well. So I call them smalls, you know, from street trees down to public art, surplus land that needs to be mowed, community centers, things like that. Municipalities have a lot on their plates in terms of infrastructure. Oop, yeah, double click, sorry about that. So in terms of infrastructure financing these days, one conservative metric I found using several data sources from the Comptroller's Office, from Environmental Facilities Corp., from a few other places, there's at least 300 to 400 communities in New York under significant fiscal stress to this day. Some of the indicators or some of the things that fuel that stress are already high debt service, you know, past projects that they bonded for. Already high water and sewer rates, right? You can only charge your ratepayers, your residents, so much before the pitchforks come out, you know, and there might be a change in administrations. Inherently low median household incomes, particularly upstate and also the North Country, means you can't raise rates that high. The state considers about 1% of median household income to be a target service charge for water and sewer. Some communities are woefully too low with that, but raising it is politically sensitive, and other communities have already probably gone beyond that rate. And that's where they need help from grants and loans and things. Oop. That's kind of weird. Okay, sensitive buttons. On the macro level, you know, you've all heard these stories: population loss, century-old pipes in the ground, and the erosion of the tax base, particularly in certain parts of the state, in the Mohawk Valley, particularly in the North Country. There's a lot of, you know, even with nanoscience here in Albany, even with SUNY Poly in Utica, Micron coming to the Syracuse metro area, those are great success stories. Hopefully those turn out to be really good things for New York State. But there's a lot of small villages and towns who are trying to rebuild their economies with recreation, tourism, healthcare, and retail and general services. And those industries, as good as they are for those of you that work in those things, they don't replace the kinds of industrial jobs that communities had 50 years ago. There's also some post-COVID impacts going on. I know we don't talk about COVID that much anymore, and things are pretty much back to normal. Businesses have reopened, but the flexible recovery money, ARPA, is all gone. It's virtually committed or all expended. The problem with that is it was a windfall. It was a bonus for places that, now have a budget hole because they may not have planned effectively to use it as a, as a bonus. So, the challenges. New York State has 1,500 or more municipalities, so we're all in our own silos, right, as local government folks. A conservative estimate, $50 billion, that's very conservative in just sort of water, sewer, and very hard infrastructure needs. And that never changes. That's a moving target, right? Communities go from one problem to the next. You finish a pipe project, and now something's wrong in your treatment plant. You don't get your infrastructure done in 1 or 2 years and say, I can take 10 years off, kind of like building a new house where you don't have to do anything for 5 or 10 years. You always have a problem as a mayor or supervisor. The fact that we've come up with, or society has come up with things like lead or more awareness to lead or PFAS means communities are dealing with problems that 10 or 20 years ago, when I started in my career, weren't problems. I remember doing some housing grant work in Hoosick Falls in the late 90s and early 2000s, to date myself. They weren't talking about PFAS back then. That showed up, recently and became a major crisis, sucking a lot of investment and stress on the local fiscal system. And in general, New York State, with all of the local governments, mostly small, there's a lack of capacity, not by their fault, to do capital planning the right way and multi-year budgeting, which people wish they could do, but it's usually crisis to crisis more than. I'm going to try my left hand. Okay. Some of the roadblocks I see doing this every day, that actually things that stop projects in their tracks from the financial perspective, grant prerequisites, right? Great grant program to do all kinds of sewer water improvements, but you need engineering reports, seeker, SHPO, those of you that know the State Historic Preservation Office, maybe archaeology issues. You need all that done to apply. And I'm talking about pass-fail things. You can get knocked out of a competition without those prerequisites. Some programs don't have them, but others that do, you need to sort of pay to play to do those grants. Limited match funds. This is obvious, right? If you're a small village and the match is 25 to 50% of the project costs, where are you going to come up with that? Not everyone is just willing to issue another bond because of that debt service kind of issue. Your ratepayers, I talked about this before, your ratepayers may already feel tapped out, and they may not want you to do another bond. So that makes it easier for a mayor or a supervisor, no offense to anyone here who's held those offices, but that makes it easier to put a Band-Aid on something and kick the can to the next administration. Like, what do you can't do it, you can't do it, or you don't feel like you can do it. So some other financing challenges, there's very few grants in infrastructure that are 100%. That would be like the golden ticket, right? 100% no match. On top of that, New York State, through various agencies, have laid regulatory policies that could add cost to your project, time, effort, and cost. You see the list there: prevailing wage, buying American iron and steel, minority women enterprise, disadvantaged business enterprise utilization goals, and then design standards. So when take a small, simple project and overlay Department of Health or Department of State's stringent rules or regulations, or their lengthy review process for something that might be fairly simple, adds complexity and may add cost and time to your schedule. No offense to those two agencies, but those kinds of things are out there. I'm going to push back on myself a little bit just to give you the counterpoint to those to those issues. Yes, there's not many 100% grants out there, but agencies want to fund more projects, right? That's to their credit. You want to spread the money around as best you can. Communities can deal with match. We do it every day. There's creatively using in-kind services. Sometimes projects small enough could be short-term using bands instead of long-term bonds and get lower interest rates. Some folks have been able to save capital reserves just for match purposes. And yes, regulatory requirements or policies are because of someone deciding to have a societal outcome to promote something that we hope is good. And those stringent design standards I mentioned, are technically meant to keep your projects in line with safety, public health, and have good outcomes as well. So that's kind of the pushback on that last slide. Okay, really quick so I can get to a little more meat. There are successes and some solutions. So since 2017, the state's been funding, I think, at record levels, as far as I can remember, into water and sewer programs. They passed an act, a statute back then that's been funneling $300 to $400 to $500 million a year into bread and butter water and sewer. The bipartisan law, which was talked about for decades in Washington and got passed in the last administration, finally, is still, to this day, moving money through the pipeline. And that was billions and billions of dollars for every state through various channels. And what I call the Flint effect, yeah, it's good that we know more about lead in our water systems. It's good we're asking questions about that and taking inventories. And it's good to discover emerging contaminants, because when there's a problem and a crisis, money tends to flow faster than when there's something more mundane that's not compelling to the politicians. So New York State also has several targeted grant programs. They're a little more specialty or niche. I won't go through that list, but I wanted to highlight City of Gloversville, which is somewhat distressed and impoverished, losing all the tanneries and other industry in the Mohawk Valley. They've been able to use less than $1 million from a green infrastructure program that EFC offers to replace all of the water meters in the city, all of their old obsolete water meters. For that kind of investment, they are going to save 50,000 gallons of water per day, which maybe in the city of Albany isn't, is literally a drop from the spigot, but in Gloversville that's a decent amount that has value and it's good for conservation. So there are some successful targeted things like that. Other creative funding strategies you can see capital stacking as long as grants can play nice together. Some agencies are now offering 40 years or longer on debt repayment, which just helps stretch that out longer. I'm not one to tell a village to take a 40-year versus something shorter, but obviously if you have to, that may be helpful. There are developers that are helping finance infrastructure, particularly where it leads to a private project. And the unique revenue source that I mentioned, this is something I'm not involved with, but I've heard a lot about the city of Cohoes, for example, putting solar arrays on their reservoir in a fairly massive way in order to generate revenue for public facilities and infrastructure in the community. As much as you would put solar on your roof and get some benefits back by that investment or have your utility bill reduced, I think the city of Cohoes, I don't know if they've done it yet, but I know it was pretty big a few years ago that they were planning to do something, but the money was going to go back into plain Jane kind of infrastructure investments.
We're out of time, so sorry.
Okay. I will flip these really quick, and you can read my ideas, and you can ask me later if we have time, and I will go through. I only have two, so, and that was my last one. Quick. Sorry about that.
And I'd like to welcome our final panelist, Leslie Reynolds, a research support specialist at Cornell University program on applied demographics. And just to add to the Cornelliness, I did my PhD at Cornell.
Oh.
And her presentation is going to be Access Denied, Hospital Closures, and Emergency Care Deserts in Upstate New York.
Thank you so much. And I also wanted to first thank the Rockefeller Institute of Government for having me. I do feel like a bit of a Cornell conglomerate up here too. And it's really amazing to see this interdisciplinary collection of people come together. And I think it shows that every single person is involved or affected by local government in some way. And so I also feel a little out of place, but all the population things I'm going to talk about today are people who live in local governments, and this has an impact on the population and therefore could be acted on by local governments in the future. So today I'm bringing attention to an issue, hospital closures and emergency care deserts in New York State. So this all stems from a federal bill, which is now public law, and I'm going to talk today about the impacts on New York State, its people, and its hospitals. Aha. Okay, so this started with the 2025 Budget Reconciliation Bill. It was formerly known as the One Big Beautiful Bill Act, and it became public law in July of last year. And this implemented many cuts and restrictions to federal programs, including Medicaid. There were 11 key provisions made to Medicaid, and it had an estimated $700 billion in federal savings. There was a paper by Rand recently that did state breakdowns of this budget as well, and I'll talk about the effect for New York State. And this estimate was also originally from the Congressional Budget Office. So there are a lot of losses because of this bill in terms of cuts, but there were also some financial gains. For example, all states will receive between 100 and 300 million annually from the Rural Health Transformation Fund. So a lot of these Medicaid cuts will disproportionately affect, or are thought to disproportionately affect, rural hospitals because they have a higher payer mix of Medicaid patients. But states with smaller Medicaid populations and lower Medicaid spending are actually set to gain more as a proportion of their Medicaid budget. So in the grand scheme of things, it won't do a lot to boost New York, but we have yet to see how this will be allocated across hospitals and counties and such. Next slide, if someone has control, other than me. So the fiscal impacts from New York State. As I mentioned before, there was a brief by Rand, a paper, and there were a few provisions that were laid out as most detrimental for New York State's Medicaid fund, and these estimates are by 2028, but they also extended out to 2034 as well. So the three biggest things for New York are the new work requirements, which would result in an estimated loss of $3.8 billion by 2028. And these include working requirements or volunteer requirements for people who are not considered to be medically frail. And that's also where local governments and state governments come in, because the interpretation of that might vary across states, or it does, and there's been discussion about that as well. There's also limits on provider taxes. So these help hospitals make up the losses from serving Medicaid payments, and that's an estimated loss of $2.9 billion. And then eligibility redeterminations. So in expansion states like New York, these are set to happen every 6 months instead of the existing 12 months, and they estimated a loss of $2.1 billion. And of course, these are estimates, so it's not set in stone, and it could be over or under, we just don't know. But there's an estimated cumulative decline in both New York State's Medicaid fund and the general fund. I'll go to the next slide, please. Oh, nice. Okay, so how does this impact the way we access care? So hospital closures are already an existing problem in the US, but also in New York. There have been 63 hospitals closed in New York State since 2000. And the expectation is that these will worsen or get more difficult to prevent under the funding cuts, especially for rural areas that are already struggling financially. So a conversion to a rural emergency hospital is also possible. But this would require the loss of inpatient beds. I talk a little bit more about these designations because this all will happen differently depending on the hospital. There are federal designations of hospitals like critical access, rural emergency, and rural referral centers, but I don't go into that much today. This project specifically stemmed because I saw a brief from the Fiscal Policy Institute listing and estimating hospitals at risk of closure under these cuts, and it found 70 most at risk, which means that for their definitions, over 25% of their net patient revenue comes from Medicaid and government appropriations. So I specifically wanted to look at the population living in care deserts, which means you reside over 30 minutes away from a hospital or from any type of care. But in this case, I wanted to look at emergency care. Believe it or not, this is very condensed from my original data and methods section. I think it's my calling as a demographer. I want to tell you every single thing I did about data and methods. But so for this project, I used state health department data to create a database of locations in New York State, of hospitals in New York State, and also in all of the bordering counties and other states surrounding New York State, because sometimes your closest hospital is in a different state. And then I attached the 2024 Center for Medicaid Medicare Service data from the hospital cost tool with information on their patient revenue. And I dealt with a number of technical things like geography mismatches. We can't all name our hospital the same thing, so we have to go in and make sure it's the same hospital, same location, and it's still open. So I also used the 2020 decennial census data for block group population counts, and I determined the hospitals most at risk of closure, so over 25% of their net patient revenue from Medicaid, and also a potential risk category, which is 20 to 25% of net patient revenue from Medicaid. Yay, we get to get into the figures, and those are my favorite parts. So this is my calculations of the top 3 closest hospitals for each block group. I also have shaded in the background there the total block group population, a little difficult to see with all the circusy colors. And this is also probably difficult to see from the back row, but we do have the paper available online now, so you can zoom in and look at your own hospital. But the closest hospital is shown in red, the second in blue, and the third in yellow. So you can see there are quite a few sparse areas already in the North Country and such, and even spread throughout the country, the state. So I looked at the most vulnerable counties first, and here when I'm talking about vulnerable, I'm talking about the people or the populations who would have farthest to go if their first closest hospital were to close. So this is the median additional miles to the second closest hospital, and I ranked all of the counties. And in the top 3 are Franklin, Cortland, and Clinton, and they all would have to travel an additional 15 miles on average if their first closest hospital were to close. Unsurprisingly, four of the 5 boroughs in New York City are at the tail end, with Staten Island as an exception, that would have to travel about 1.4 miles on average for that population. So here, I think, is the meat of all of this. So I looked at emergency care deserts, and there's a lot of different ways you can define this, but for most of the state, I used 15-mile buffers, and that roughly estimates to 30 minutes, but you could become more advanced in the calculation and do a network analysis with travel times. But for a rough estimate, I also did 5 miles for New York City and Nassau County. And Suffolk County, I also used 15 miles, and Connecticut was an exception at 10 miles. So on the left is the current hospital landscape, with those red circles being hospitals that are at any risk, so over 20% of their net patient revenue from Medicaid and government appropriations. So on the right, that shows us if all of those hospitals were to close. And obviously this wouldn't happen in a vacuum, and not all of a sudden all these hospitals are going to close, but this is to exhibit the potential maximum impacts of the list of closures. Like when you publish a list like this, and we don't necessarily digest the impacts of what that could mean. So on the right, we see those swaths of emptiness around the hospitals grow even larger. Oh, wonderful. So how would emergency care deserts change if these closures were to occur. So I used two kind of scenarios, and that would be the current deserts, and then the scenarios are if all at the most at-risk hospitals were to close. That's over 25% of their net patient revenue. And then if all hospitals at risk were to close, over 20%. So downstate is over half of the state's population, but only 8% of the state's current emergency care desert population, so approximately living over 30 minutes from a hospital. So this chart, from left to right, I have the total population in New York State, downstate star, which in this case includes Rockland and Westchester counties, as well as Nassau minus Suffolk. I know that's very contentious to have upstate downstate argument, but for this case, there are geographic reasons why I did this. And so if the most at-risk hospitals closed, the emergency care desert population would or could grow to over 1 million people. And then they disproportionately impact upstate and Suffolk currently, but they would also be expected to grow in downstate. So overall, it could grow if all hospitals at risk were to close. This would be almost 1.6 million people who are over 30 minutes from a hospital. And this doesn't even include the time that it takes for the ambulance to get to you if you have to take an ambulance. So future research could also look at ambulance bay distances and how that impacts different areas. Oh, whoopsies. I have too much power. Thank you. So I also wanted to look at how this would impact the characteristics of people in emergency care deserts. So really quickly, I looked at the average median age. I weighted it by block group population. And how this would change. So in downstate, it already skews younger than the rest of the state, so 37.9 on average. But New York State is slightly older and upstate is older still. But with each scenario, if hospitals were to close, this median age affected by emergency care deserts would get younger and younger, with the exception of downstate, which got quite a bit younger in the first scenario with all, most at risk to close, and then a little bit older if all at risk were to close. And this has something to do with the composition of hospitals that are most at risk and where they're located in terms of age. So these are the conclusions that I've talked about the most vulnerable counties and populations that have to travel a large distance already. So these are disproportionate impacts, and I think there's a lot of future research that can be done. And this isn't necessarily local at the surface, but it's made up of all of the localities that have been mentioned today, and each hospital will experience this in different ways. So I think there are a lot of ways this analysis can be changed, and I think this is a first step to quantifying the potential impacts of this new law. Oh, that was my
of our panelists. Figure out why that hates me. I'd first like to thank all of our panelists and open it up to questions. I do want to comment on how valuable I think it is, especially when we're talking about smaller communities and those that are further from urban centers, to have all of these panelists talking about very different pieces of that infrastructure together. And it kind of gives a little bit more shape to some of the challenges that these communities are facing pretty much from every angle as they move into the new world. So questions?
Just a statement. I'm the general counsel of the Environmental Facilities Corporation. Thank you, Jim. I really appreciate your insights. We work really hard on that issue of the small community. It doesn't matter if you're New York City. You know, this week we've spent innumerable hours on those small communities. And I think I appreciate your frustrations. One of the ways I would encourage folks to think about EFC is we're an infrastructure bank. And so we buy notes and bonds issued by local governments, grid notes, you know what these are. And we need to get repaid because we have a recycling rate that needs to be attended to through the SRF so that we can plow that money into new projects. We're also subject to audit by OSC, the EPA. We had a bond closing of tax-exempt bonds on Tuesday, so we're subject to audit by the IRS, the SEC, because we're in the public securities markets. So again, I would just encourage sort of the more dynamic view of us, and we work really hard on that issue of the small community, small disadvantaged communities. Thanks.
Yeah, I appreciate that. I agree with you. We use your programs all the time. I mean, we advocate for WIA and the EPG and things like that. So it's not frustration if it came across that way. I apologize. It's more, are there some tweaks with block granting or maybe reducing duplicative programs that have different goals so that mayors and supervisors aren't confused about what to apply for? Your community action teams, I think, is a great way forward with technical assistance. So it's not frustration. It's just how do we all make it better?
Yeah, get the applications in by July 27th.
Right.
We've got our WIA program out there. So.
Right.
More questions?
Thank you so much for your wonderful presentations. This question is more for Joe. I'm originally from Schoharie County, and I've seen a lot of lawn signs kind of pop up recently about anti-solar and other kind of pushbacks to these renewable projects in rural upstate counties. And I was wondering if you faced any pushbacks and how you're kind of handling that with these projects.
Yeah, so it's growing. I think some of that might be political rather than really what's going on the ground. As an agricultural area, I would say, despite the kind of larger narrative on wind has been very well accepted, and it really does not compete with our agricultural land much at all. We are seeing a bit more pushback on solar. We have a handful of projects built already. There wasn't a lot of pushback when they were built, but now that they're built and there's more proposed, and it's definitely one of the angles is it's a much bigger land use per megawatt produced than wind, and in a county that relies on agriculture and natural resources for our economy, there's a lot more concern. And in our area, wind farms would be accepted all day long, and it's not that we're seeing a huge fight against solar, but there's some growing discontent with how much land. And if to me, it's a land per megawatt, and it's not land per. Sorry, I'll go on a little tangent. It's not land per megawatt of a total wind farm, because you'll see there's only 100 megawatt on 25,000 acres. Well, no, that's not the footprint, because our farms continue to farm around it. I did some calculations on our wind farms, and if you actually count the land that's taken out of production for the little roadway and the base of the tower, it's about 0.67 acres per megawatt, where our solar, usually we see a lot of estimates of 5 to 7 acres per megawatt, so almost a 10x increase in land used on a solar array versus the footprint of our wind towers. So, yeah.
More questions. I did see a couple more hands.
I just had a quick question for Leslie. In the map that you showed after the hospitals closed, you mentioned, I was curious why St. Lawrence County wasn't included as major, because it looked like they didn't have anything left. Just a question.
Why it wasn't included?
As most impacted, because it looked like there weren't any facilities in that whole corner of the state.
It could be, but that also could mean that their closest hospital would then be in the next state. So it was the average. I think you're referring to the counties most vulnerable to closure with the the distance to the next
their
one.
only closest area would be Canada. So
But right across, it could be something different with the calculations, and probably because a couple of those counties in the North Country were just so high in terms of miles and the weight by the block group population. So it takes every single block group in the state. So if there aren't enough block groups to overcome, say like Hamilton County, which there's nothing in the county, there's nothing next to the county, that it might just be the ranking. But I would be happy to show you, I have some more detailed, I have lists of hospitals as well, and I can't remember exactly the situation with St. Lawrence. If, I think there were 3 hospitals, and I think they are all over 20% of their net patient revenue from Medicaid. And that's very unlikely that all of a sudden it meets this threshold, so it just closes. And there are things with, the hospital network and the ownership of the hospitals and things like that at play. So that is just an estimate, but I am also curious of where the next closest place, because I don't think people are going to be going to Canada, but that's
Thank you.
Sure.
Well, I would like to thank everyone for being here, especially the panelists and our wonderful question askers, and welcome Lisa Parshall back up for some closing remarks.
So very briefly, I just again want to thank all of our panelists for the valuable insights, our audience for their engagement and participation, and also a big thank you to the staff of the Rockefeller Institute for putting this conference on again and the wonderful job that they do. So what we really want to do is just carry forth the momentum from today's discussion, continue working together. Hopefully these were conversation starters and not conversation enders, to keep up with the creating positive change for our communities. So again, thank you all for joining us, and everyone please travel